This lecture is about the visual system. First, we're going to have a quick look through basic anatomy. We will then pass on to the main eye diseases and symptoms. We will later on talk about history taking, and I'll introduce the questions you should ask a patient when you suspect an eye problem. Afterwards, we will review the most common diagnostic tools and treatment options. Let's start with the accessory structures of the eye. The accessory structures of the eye are the eyelids or blephara, eyelashes, eyebrows, lacrimal apparatus, and extrinsic eye muscles. The conjunctiva is a thin mucous membrane that covers the front of the eyeball and the inside of the eyelids. The superficial coat of the eyeball is called the fibrous tunic. It's avascular and consists of the anterior cornea and posterior sclera. The vascular tunic or uvea is the middle layer of the eyeball. It has three portions: the choroid, ciliary body, and iris. The hole in the center of the iris is the pupil. The anterior cavity of the eyeball is filled with a watery fluid called the aqueous humor. The retina, which lines the posterior three-quarters of the eyeball, is the beginning of the visual pathway. The site where the optic nerve exits the eyeball is called the optic disc. Each retina has about 6 million cones and rods. The exact center of the posterior portion of the retina is called the macula lutea. The zone that contains only cone photoreceptions is called the central fovea. Just posterior to the pupil and iris is the avascular lens. Now let's review eye symptoms and conditions. Excessive intraocular pressure is called glaucoma. Clouding of the lens is called cataract. New blood vessels growing over the macula is called macular degeneration, usually age-related. A rapid involuntary movement of the eyeballs is called nystagmus. Now let's review the abnormalities of refraction and accommodation. Nearsightedness is also called myopia. Farsightedness is called hypermetropia or hyperopia. Inability to focus vertical and horizontal lines at the same time is called astigmatism. When the lens loses elasticity and ability to accommodate, we call it presbyopia. A condition in which the eyes focus on different points is called strabismus. A condition in which the retina is partly detached is called retinal detachment. Now let's pass on to types of blindness. Night blindness or nyctalopia is often caused by prolonged vitamin A deficiency and the consequent inability to produce a normal amount of rhodopsin. Daltonism, from John Dalton, who was an English chemist. John Dalton is best known for his pioneering work in the development of modern atomic theory and his research into color blindness from which he was suffering. A lack of normal vision without structural cause is called amblyopia or lazy eye. Blindness caused by disease of the optic nerve is called amaurosis. Partial blindness is called hemianopsia. Now we're going to review eye infections. Inflammation of the eyelids is called blepharitis. Inflammation of the conjunctiva is called conjunctivitis. Inflammation of the cornea is called keratitis. A bacterial infection of sebaceous glands of eyelashes is called hordeolum or stye. Now let's review the questions that you should ask a patient if you suspect an eye condition. First, let's review the questions around visual acuity. Do you wear glasses or contact lenses? Have you noticed any change in your vision? Are you short-sighted, long-sighted, astigmatic? Are you able to read from a distance? Do you have any blurry double vision? Do you notice any distortion in your vision? Do you have spots or floaters before your eyes? Do they affect your vision? Photophobia. Are you sensitive to light? Does glare bother you, especially at night? Pain. Are you in pain? Do your eyes burn? Eye trauma. Did you receive a blow to your eye? A speck of dust? A splash of chemicals? Allergy. Do your eyes itch? Do your eyes sting? Diabetes. Are you diabetic? Drugs. Are you taking any blood thinning medications? Are you being treated for high blood pressure or diabetes? Do you take birth control medication? Are you taking any vitamin supplements for your eyes? Now let's review the main diagnostic tools that are being used in ophthalmology. There's a battery of eye tests to assess vision and ability to focus on and discern objects. First, let's focus on external examination of the eyes, which consists of inspection of the eyelids, surrounding tissues, and palpebral fissure. The standard definition of normal visual acuity is 20/20 or 6/6. An examination of the pupillary function includes inspecting the pupils for equal size, regular shape, reactivity to light, and direct and consensual accommodation. These steps can be easily remembered with the mnemonic PERLA: pupils equal and round, reactive to light and accommodation. A swinging flashlight test may also be needed if neurologic damage is suspected. Ocular motility should always be tested, especially when patients complain of double vision or physicians suspect neurologic disease. Testing the visual fields consists of confrontation field testing, in which each eye is tested separately to assess the extent of the peripheral field. Intraocular pressure can be measured by tonometry devices designed to measure the outflow and resistance to outflow of the aqueous humor from the eye. Ophthalmoscopic examination may include visually magnified inspection of the internal eye structures and also assessment of the quality of the eye's red reflex. Dilated fundus examination is a diagnostic procedure that employs the use of mydriatic eye drops to dilate or enlarge the pupil in order to obtain a better view of the fundus of the eye. Close inspection of the anterior eye structures and ocular adnexa are often done with a slit lamp machine. What about the treatments? Refractive surgery aims at correcting errors of refraction in the eye, reducing or eliminating the need for corrective lenses. In case of cataract, if visual loss is significant, surgical removal of the lens may be warranted, usually replaced by a plastic intraocular lens. Corneal transplantation, also known as corneal grafting, is a surgical procedure where a damaged or diseased cornea is replaced by a donated corneal tissue. Next are examples of medication that may be used in ophthalmology. Most drugs come under the form of eye drops. The prostaglandin drug class is currently the gold standard for glaucoma treatments. You can also find cancer drugs such as Avastin to treat age-related macular degeneration. Mucin secretagogues work to directly stimulate the production of lubricants in the eye. Thank you for your attention.